So how's that race been so far?
Well, we already had our primary. Our primary was March 17th, which we were successful. So we consider the race going really well at this point. But so it's a long process from the time that we started running for office till the primary race. I announced I was running for Congress on July 9th of last year. So it's
Mhm.
been a long 9 months, 9 months of building relationships, getting endorsements, raising funds, being out in the community, learning the district. The district is very big. It spans from the city of Chicago to the suburbs of Chicago down to Kankakee, Illinois, Danville, Illinois, and everything kind of in between. So it's a very long, skinny district
Mhm.
that's suburban, urban, and rural. And a good portion of the district overlaps my current commissioner district.
So, and from my understanding, it's a pretty blue district, but I mean, it still has its challenges, right?
Oh yeah, no, it's a pretty blue district, but because of the diversity of the
Mhm.
district, um, being, kind of like three different whole communities, it has a lot of challenges and a lot of needs and a lot of issues that face many constituents across the district that might be the same. So one of the
Mhm.
things I kept saying during the primary is that, you know, along this whole diverse district, one thing kept ringing true that people were concerned about healthcare.
Mhm.
People were concerned about making ends meet. The affordability crisis has hit every part of the district.
Yeah.
There's 4,400 farms in this district. So farmers are feeling the hit directly in our food choices within the community and externally outside of the community. So those are issues no matter where you are, you feel that as a
Mhm.
constituent.
And from an understanding is that a lot of people don't really realize living in a certain location. This may not be true, especially for like that district that you live in, but it is true for so many areas throughout the country that some areas are food deserts that they don't have accessible access to nutritional food, and I think that's a huge issue. And when we're talking about healthcare and we're talking about food scarcity, it kind of goes hand in hand because not having nutritious food also affects healthcare and it affects like every portion of your life. So impacting the farmers, that's pretty big for someone that does have the the ability to have access to that food and not having priority over their needs is kind of tough.
It's very tough. So one of the things, so currently I'm a Cook County commissioner,
Mhm.
and just for your audience, because I know you're broad across the whole country,
Yeah.
um, Cook County is the second largest county in the whole country. So when you talk about food insecurity and food deserts, we see them in very different communities, but
Mhm.
we see them consistently. So there's a definition for what defines a food desert by the CDC and the USDA. And we have multiple food desert tracks throughout all of Cook County. You might
Okay.
think it only hits areas that, are look affluent or what have you, but not having access to fresh fruits and vegetables and fresh meats affects all communities. So, for instance, I live in Linwood, Illinois. Linwood, Illinois is on the border of Indiana,
Mhm.
but we are in a food desert. My area that I live in is designated as a food desert. So, one of the things that I did as a Cook County commissioner was to work with the Grocers Association and other organizations that want to bring mid-level grocery stores
Mhm.
into communities. So we're not just having the big, you know, uh, big grocery stores. I don't know what the big ones you have, but we have Jewel Food Store here, Dominic's. Those are big ones. Whole Foods, those are big ones. But we want to say, how could we incentivize someone to have a grocery store that's a mid-sized grocery store that meets that food desert criteria, to come into an area that meets the food desert criteria, and I created a tax incentive for that. So, and there were other stipulations on the tax incentive. The tax incentive wasn't just coming to the community, it was also hire from within the community, people to work in the grocery store who actually live in the community. Make sure that your certain square footage has of the store has fresh fruits and vegetables, fresh meat, and meets that criteria. And the square footage of the grocery store had to be a certain size so that it fit into the mid-level grocer category. I think that's a way that we can help eliminate food deserts, but it also is a way that we bring community back into grocery shopping
Mhm.
so that people shop in their own community. They see people they know. You see the person who works there because you know them. So far, we have only had two applications for that tax incentive. And I just found out yesterday that we have three more. So hopefully this is
Mhm.
catching on. Now that's at the local level of government. So this is something that I would like to take with me to Congress as well. Like, how do we incentivize mid-level grocers across the country to come into community? So I'll be working
Right.
on things like that.
Yeah, and then even then, it comes to down to two things: is accessibility and affordability, and that's also an issue because you could have access to the fruits and vegetables, but if they're not affordable, people do tend to lean towards sugary drinks and just ultra processed foods anyway. So that's also an issue.
It's a huge issue, and that's another thing that I think can be legislated, if you want to say that. There used to be a time where we had public service announcements that
Mhm.
came through just regular TV. Well, now we have so much, ways that people can communicate.
Mhm.
But I do think we need to go back to having educated experts come and talk about, it's not okay to drink one drink that has 50 grams of sugar in it.
Right.
And it comes, I was shocked. I just went to Dunkin' Donuts, where my husband loves Dunkin' Donuts coffee, which is bad. But we went to Dunkin' Donuts and they have a new drink there, and they're touting that this drink, I can't remember what it's called, but it's caffeine free.
Mm.
But no, it's not caffeine free. Yeah, it's caffeine free, but it has 100 grams of sugar in it. Because I was
Wow.
like, oh, I might get this. And I just said, let me just see. I don't even know what made me check it, but I checked it. 100 grams of sugar in one drink. So if you drink that drink, you are done with your sugar amount of intake, not just for one day, probably for 4 days.
Mhm.
But people don't realize that because it's just one drink and it tastes good. But we need to get back to educating the public on how much is too much, how much caffeine is too much. Why
Mhm.
is it bad? It destroys your body from the inside out. So I am a huge proponent of that. And I just think that if we could educate a generation on how to make better food choices, that we would change the health of our country or communities easily.
So I also think that one of the things that could happen is to pass legislation on how companies could market their foods, because this is a trend that I see so often now, and it's so common for a lot of products to be labeled as protein when they might be high in protein, but they might be high in everything else, which kind of eliminates that. So there needs to be some legislation so these companies don't market their products as healthy when really they're not.
Exactly. I agree with you 1,000,000%. So I'm going to start digging into that. Like, what happened? Something changed at some point in our
Yeah.
country where we stopped educating. We used to. So why did it change? And I don't have a good answer as to why it changed. But I do know that it helps, corporations make a lot of money. And when you go to other countries, they don't have the same issues that we have here
Mhm.
as far as how their food is processed and what kind of food there is. I mean, even I'm using McDonald's as an example,
Mhm.
but the McDonald's in the United States and the McDonald's in Spain have two different menus.
Mhm.
Completely, they have fries and we have fries, but their fries are not like our fries. So just
Mm.
little things like that make a difference in the health of the community.
Oh yeah, and I think this is an area that where we could work with um, Trump's administration, because you don't have to agree with everything they're doing. That's kind of what happened with RFK Jr. He's went in there. He might not be the best person that you look towards for vaccines if that's not something that, or a position that you don't agree with necessarily. But when it comes to food, he might be wrong on some things, and you don't, or you shouldn't allow everything else to cloud your judgment when it comes to certain issues. That's kind of what happened with him, because he's a very big proponent on climate change. And Trump told him, you know what, just stay out of this. I'll handle this, but do what you want with within the health department. And I think that's where we could work with other administrations, with Republicans and Democrats, even though you don't have to agree on every single issue. I think focusing on health is something that we could all agree on, that the our food supply is basically poisoning us right now at this moment.
It is. And we don't even realize it.
Mhm.
And it's a slow, unhealthy lifestyle that we're all leading. And it's due to how we advertise. It's due to how we look at the food chain here. RFK just put out something where he's changing the food pyramid. And we just have to do better. And we have to
Mhm.
listen to actually people who've studied this. We have to listen to scientists, and we have to
Mhm.
base it off of clinically relevant information, because it's out there. It's not that
Mhm.
it's not there. It is there. We just have to dig in and find it.
Yeah, because from what I understand is that the food pyramid that we grew up knowing about was not accurate to its full extent on what was nutrition is for us. And I think that's also an issue, because we are living, and this is something that we could all agree on, that we're living in a totally different uh, time now. Because when I was growing up specifically, we didn't see as many protein and healthy options. But now, as you had a surge in protein and snacks and foods, also a lot of other products came along and tried to hide through this trend of having everything protein. I saw an ad the other day about Popeyes having a protein box, but it's fried chicken. I mean, that's one of the things. Yeah, you're not wrong, but it's fried. That's not really healthy.
Not at all. And how do we? Yeah, I don't eat chicken out. I don't eat fried chicken out.
Yeah.
But we have to, it's a re-education.
Hmm.
I one time I was at the hospital, waiting for appointment, and I saw a woman pour some of that zero, I forget what it's called, but it's like Gatorade. It's called something zero, and she poured that into her baby bottle and gave that to the baby. That
Oh man.
was straight sugar. First, the baby was, it literally killed me to watch this, because maybe she thought it was orange juice because it was orange, or there's no difference. That's why we have to educate people. But the
Hmm.
baby was sitting there quiet at first. Soon as she gave him that drink, he went crazy, because now he's on sugar overload.
Hmm.
And now he's screaming and crying, and now she's getting all razzled. I mean, so it's a effect that it has on people. And that was instant, because this is a child who really shouldn't have had 25 grams of sugar at all. And it's probably more than that in the first place. But if you don't know, you don't know that that's what's
Hmm.
going to happen. You don't know that's why now he's hyperactive and screaming and crying. And now you're screaming and crying and at the baby. It's terrible. So we have to do a better job educating people.
Oh
And
yeah.
that's been lost, I'd say, over the last 25 years.
Hmm. Yeah, and it's because now there's so many different options, but at the same time, especially when it comes to sugar, it goes beyond that, because we're now facing corn syrup, and we're facing all these artificial sweeteners that we don't even know what they're doing to the body. And on top of that, we have these products with a long list of ingredients that you can't even pronounce.
Exactly.
And
Right.
And when you look at it, a lot of these products are produced by a small amount of companies, of these conglomerates, that even though you may have the illusion of choices, you really don't. But it's just the way that
Mm-hmm.
all these products are marketed as being different when you're basically just eating the same thing.
Yeah, exactly.
Yeah. And another issue is there are people that consume all these products, right? And they face uh, weight gain, but sometimes, at least most of the time, it's not necessarily their fault, but it's the lack of education because they're consuming these products, especially products that are high in carbs. They're eating these products, they're not realizing the amount of calories that they're eating. And
Right.
before they know it, they have all this weight gain that also leads to health issues. It leads to higher cost dealing with health issues. So it's just a revolving cycle that starts from the food that you eat and a never ending cycle of needing medications and all of that.
Oh, yeah. So I'll give an example too. So I have two sons, and when my son was in middle school, they take gym. And at that time in fifth grade, the majority of the girls were obese in his
Mhm.
class. By definition, maybe they don't look as obese, but by definition, they were obese. They
Mhm.
were in the PE class one day, and the teacher said, "We're going to do these exercises." Well, they didn't want to do them. And my son's telling me this story. He's like, and all the girls started crying because said, he's picking on us and he's trying to make us do things that we can't do. He said, I only want you to try,
Mhm.
because if you try a little bit every day, then you'll eventually be able to do more. And they did not want to try at
Mhm.
all.
Yeah,
And that's where we have a problem.
because I think it comes down to a society that we want to not offend many people, right? And we've grown to this society to like make people feel comfortable in a certain situation than tell them or give them guidance that it doesn't have to be like this. So a lot of people do feel comfortable, but when it comes down to it, it's all these corporations that are at the very top producing all of these products and pushing this narrative that just giving them a quick rush of dopamine, and it comes down to that. Now you're dealing with people that are overweight, and even calling them obese, you're feeling like you're offending them, but it's just the medical term of being past a certain weight. So we need to leave that narrative behind and look at this as a health issue, not necessarily just as a labeling issue.
Absolutely. I agree so much on that. And it starts at a young age.
Mhm.
And you can educate. I do believe you can educate, but when we make it easy, like you're saying, all these fast food places are in communities. It's easy to just run and get a cheap meal as opposed to preparing something. Why should you can get a whole meal at a fast food place for less than you could get a good meal that's fresh food and vegetables, fruits and vegetables, and it should be the other way around.
Oh
The
yeah.
fast food should cost more than the salad
Mhm.
ingredients or the food at a restaurant that doesn't have fried chicken.
Yeah, and I think we're getting to a point, and I don't know why this is, but fast food is starting to be as expensive as just cooking at home. But it's just the accessibility to fast food and not having the time to cook at home, or just not having the education on how to prepare a meal, that's leading to a lot of people just going and buying a burger because it's just easier as well.
Right, exactly. I know. I spent many years making sure that we ate at home more than we didn't eat at home.
Mhm. Yeah, like it's also something that if you eat at home, you start to develop a different taste for at home cooked meals that you're not going to want that burger as much, because if you do go and eat that burger after eating at home for so long, you're going to start to feel sick. But it's something that has been disguised because you eat it so much, you don't know how to differentiate of feeling good and feeling bad, because you're always feeling like low energy because of the food that you're eating. So it just becomes this new normal.
Exactly. Exactly.
Yeah. And so now with, I know that you're a big proponent for healthcare. Talk to me a little bit about that.
Well, yeah, I've been addressing healthcare disparities for decades and particularly focused on women's healthcare, not only women's reproductive rights and women's healthcare for, abortion access and beyond, but also maternal healthcare. We have a maternal healthcare crisis in our country right now when it specifically affects women of color. And it's in every part of our country where women are dying as a result of childbirth or beyond, either at some part of their pregnancy. And this is a phenomenon that has been identified, but it's also been identified as being preventable. So anytime it's been at 90% preventable.
Mhm.
So the real issue is, and I've talked to so many physicians and people in the healthcare industry, the issue is not listening to women, especially women of color. Black women are perceived to have a higher threshold for pain.
Mhm.
Black women are perceived to, be misunderstood from an education standpoint. Like they might just dismiss what you're saying because they don't think you know what you're talking about. And that issue actually happened to me. And that's why once I started realizing that this is happening to so many women, that if you don't have an advocate on your side when you go to the hospital, whether you're going to just a clinic visit, a physician visit, a maternal health visit, or a delivery, then this is where the miscommunication happens. So when I
Mhm.
went to have my son, so who's now 22, so this
Oh.
was many years ago. When I went to the hospital, they do an intake. So they ask you all these questions, and this is like before your delivery. Luckily, my husband was there with me, and an intern, well, a resident came and asked the questions. That's a whole nother story that
Mhm.
I don't, I didn't want to have a resident talking to me during
Mhm.
my delivery. And so anyway, he starts asking questions and he says, so, okay, have you ever used drugs? And I said, no. He goes, oh, okay, so you've never used drugs like that. And I said, no. He goes, oh, so you're sure you'd never used drugs? And so I'm just like, wait a second. Like, first of all, I'm about to have a baby right now. And so I said no. And I'm looking at my husband like, what is his problem? And so my husband said to him, why did you ask her that 3 times? He goes, oh, I wanted to make sure she understood the question. And so he's
Mhm.
like, yeah, she understood the question and asked and answered. Let's move on. And now I'm just like so mad. Um, and so my husband's like, you know what? I think you and I should go talk outside.
Mhm.
So then I didn't see him anymore because it was such an inappropriate line of questioning, number one.
Mhm.
Number two, very assumptive. Like, just because I'm an African American woman, I've been using drugs at some
Mhm.
point. And then further insulting, you want to make sure I understood the question. Of course, I understood the question. You're asking it very directly, and it's really a yes or no. So, not hard to understand.
Mhm.
So, but that's just the implicit bias that gets put into how you're talked to, how you're communicated with, and how they view you, no matter where you are on any sort of education level, um, whether your economic, level, doesn't matter. So this is part of the discrepancy and disparity and bias that Black women experience when going to see a physician. Now, in that case, that person did get removed from my case, but that was because I had someone there with me who could speak up for me and say, we don't want to see this person anymore. Many people might not know that they could even say that. that they could say, I don't want to talk to this person anymore. So, or have someone there with them. Or, I mean, I wasn't in active delivery, but at that moment, I might not have been in, the mindset to want to deal with having a problem. It was all I'm thinking about is delivering my baby
Mhm.
and not thinking about, oh, I'm going to have to, now I'm going to have to get somebody in here to write this person up. And, a lot of things that don't want to have top of mind. And that is just a small example. Many other things have happened to women across this country. We just had an incident here in Illinois where a woman was in active labor, went to the hospital. They're asking her all the questions. Then they said she's not in labor. And even her husband, who was with her, was like, well, so you're sending us home? Like, what are we supposed to do? And they were like, yeah, just go home. She goes and gets in the car. She ends up driving not that far, had the baby in the car
Wow.
on the way home. So they did not listen to her symptoms. They did not care about what she was saying. They were so busy asking her all the questions that they thought were important instead of listening to where she was. So because of that, there is something before Congress in her name called the Wells Act, so that we can bring this issue to the forefront. And this is a multi-generational issue because women are also having babies at different, age groups. So this is also not just, it affects young women or older women. It's all women. So we need to raise awareness about how physicians are speaking, how they are not listening to what, especially women of color, but it's more disproportionately affects African American women, and what we're going to do about that. How are we going to
Mhm.
fix this problem? Because if she did not have, I mean, luckily her baby was born healthy, but what if it wasn't?
Mhm.
What if something would have happened to her in the car? What if so many things could happen, but so many things have happened to so many women. And unfortunately, many have lost their lives.
Yeah, and people don't realize that this happens all the time. It's not something new. It has happened, I mean, forever.
It really has. And so now we're collecting data. So we have to collect data on this. We have to, you know, find the statistics on where we can make the change. So because of that, for the last 3 years, I've held hearings in Cook County. So Cook County also, for those in the audience who might not know, has the largest public health hospital. And what does that mean? That means you can go to Cook County Hospital regardless of your ability to pay.
Mhm.
So it's for the uninsured or underinsured. So Cook County Hospital has an OB-GYN department, delivers babies, and does a pretty fair job of, making sure that the incidence, having low incidence of complications. But I said, after we have these hearings and after we brought in experts and we've talked about this for a couple of years, what could we do to help really improve the outcomes for African American women, women of color, who not just come to Cook County Hospital, but any hospital?
Mhm.
And I'm sorry, can you hear that? Let me close this.
Oh, uh,
Okay,
y-
someone's on my deck out there.
you're good.
Um, sorry. So, how can we improve those outcomes? And so we came up with establishing a doula program. So we have the first ever doula program here at Cook County Hospital, where any woman who comes to the hospital can get a doula at any stage of their pregnancy. What's a doula? A doula is a mid-level provider that serves as kind of like an advocate for the patient. So remember I was saying like how my husband was able to say, hey, we don't want this person around me anymore. A
Mhm.
doula is not only experienced in labor and delivery, but they also know patients' rights for every hospital, because most hospitals do have a patient bill of rights. They also know, what should be happening at certain stages. And if it's not happening, they are prepared to either equip the woman who's having the baby with the information to say, hey, you know what? You should really ask them about this, this, and this. And then they can do that for themselves, or the doula can do that. If you've given the doula the right to speak for you in the room, and many have and can, then the doula can do that. So this is just another layer to help improve those outcomes. And I'm so proud of this program because we're going to have the statistics on it. It's been in effect for 1 full year as of this month, actually.
Oh.
So we'll have some data to say, you know what, we had X amount of people did get a doula. We had these people who had complications or less complications or no complications. That's the
Mhm.
goal, to have actually no complications. And because of having a doula, it's just more reassuring. It's also just another layer to have someone communicate medical terms. They're not physician, they're not a nurse,
Mhm.
but they are an advocate, or they teach the parent, the family, how to advocate for themselves. So this is something that we also can pay for on a national level if we have insurance or not. Many insurers, not many, several big insurers are now
Mhm.
looking at adding doula services into their commercial insurance. But we need to make this kind of like a universal thing. Like if you want
Mhm.
a doula, you should be able to get one, just like you can go to a doctor.
Right. Yeah. Because also, it's very similar to how the justice system works and how many, especially young people that don't know that they have rights, it almost sounds like that. I mean, I've seen it, I've faced it a couple times that, especially when it comes to young people, that they take it advantage of because they don't have the knowledge necessary to really fight against a system. And it seems like the healthcare system is working in the same way, and it comes down from uh, all these medical insurers. But do you think that having a single payer healthcare system could be effective?
I mean, there's pros and cons to that. And that's something that I think we need to work out in a broad conversation. Ideally, that would make us have insurance for all. And I do believe in making sure that everyone does get coverage. Um, but, there's here, especially in our country, we have too much influence from insurers.
Hmm.
So that's where the pushback comes. That
Hmm.
not the health of the patient,
Yeah.
not what's best for people, what's best for these companies. So
Hmm.
that is something that we have to legislate, and we have to make sure it makes sense across the country. Like here, like I mentioned about having a public health hospital, every state doesn't even have that. Every county doesn't have that. So that's a disadvantage, that people without insurance have nowhere to go in many places, and they just will skip out on their healthcare needs. So
Hmm.
we have to make something that works for everyone. And the health of our country is probably worse than it's ever been right now.
Yeah, because even then, there are people getting incarcerated for the simple fact to get that free healthcare. And a lot of health issues are looked at as criminal issues, especially when it comes to drug abuse. That there's certain things that shouldn't be criminal issues, they should be healthcare issues. But we're doing such a bad a job at differentiating between the two that some people that just need good healthcare are ending up in prison, and that's also a bad thing.
That's bad. And here in Cook County, we have Cook County Jail. And unfortunately, Cook County Jail is the largest mental health provider, just for that, what you're saying. They did a study looking at people who come in and out of the jail population, and the majority have some kind of behavioral health need. So that shouldn't be either, that they're getting, it's great that they're getting some sort of care if they come to jail, which means they didn't get it before they got there. And maybe that did lead to the fact that that's how and why they did whatever crime they did.
Hmm.
And then when they come in, they do get those services, but then when they come out, they might not have those services anymore. And then that creates another revolving door cycle of, especially for behavioral health issues, the issues being repeated and not managed in any way. So we have a huge need for more and better and broad-based behavioral health care.
Yeah, and there's also people that don't even look at have mental health as a real thing because they can't physically see it. You know, if you break your arm, something along those lines, you could see it. But when it comes to mental health, they just look at some people like they're crazy when that's not always the case.
Right. Well, I would love for, I'm always like a call to action person,
Hmm.
right? So I think with all of these issues, whether it's women's health care, reproductive health care, maternal health care, behavior health care, we need people in the community to be vocal advocates. And you can be a vocal advocate on any level of government or any and every level of government, which I think people should be. If we don't take control of this, it's already out of control, but how can we rein it back in? We need to hear from people who care about these issues. I'm not saying we don't, but we need to hear about it in mass. We need
Hmm.
to hear from more and more people over and over and over and over again, because that's how things get done
Hmm.
when people realize, you know what, they're not giving up on this.
Yeah.
No, we're not going to give up on this. We do think if you think a single payer system is what we should have, we need to work for it. We
Hmm.
need to make it happen. If we think that we should not have, people incarcerated that have behavioral health issues, we need to have behavioral health centers on outside of the jail so that they can get the services that they need. Many people also just need social services. They need jobs. They need, groceries. I mean, all these things that affect the community, but we need people to write letters, to
Hmm.
advocate, to lobby, to build it up in their communities. If something goes away, we had behavioral health centers closed across the board in the Chicago area. They just went away.
Hmm.
And we should have had more public outrage about that.
Yeah.
And the public still can make things happen. And so that's
Hmm.
what I say when I get a chance to talk about anything. Is like, go to your city council meetings, go to your county board meetings, come to Capitol Hill. It's
Hmm.
open for everyone, but we need to see everyone.
Yeah.
And then that's how we can get things done.
And it shouldn't even be that way. I think every voice should matter. You don't have to make so like a lot of noise for something to get done. And I think that's the biggest problem because if you voice your concerns as an individual person, nothing's really gonna get done until you're able to make a lot of noise and you bring a lot of people with you to make it look like an issue that just won't go away. But it should be the fact that every opinion should matter. And that's why we individually vote for representatives.
Agree. But collective voices do matter.
Oh, yeah.
So the more voices do matter.
Yeah.
And if you're one person that has an idea, the chances are you're not the only person thinking of that, but you
Hmm.
could be the leader of that idea.
Hmm.
You could go empower your community to open a grocery store. I'm just
Hmm.
using that as an example.
Right.
Whatever it is, you could be that person.
Hmm.
And it just takes you to bring it up, because then
Hmm.
other people will say, "Yeah, you know what? I was thinking the same thing. How come we don't have that? What let's make it happen. What do I have to do to make it happen?" And don't give up.
Hmm.
Don't give up. Keep at it until it happens. Change doesn't happen overnight. It does happen, though, chipping away little pieces all along the way.
Yeah. No, that's true. And I hope that we are able to get to a point that change does happen and it stays like that because it just seems that we're facing with the same issues every single election cycle that change is going to come, but it never actually comes.
Well, change does come. And I heard a quote, and I'm probably butcher it, but it does say that it might not happen in one election cycle, but it's the culmination of all the election cycles that make it happen at some time.
Oh,
So
yeah.
that's like the don't give up part.
Hmm. Yeah, it might happen a couple decades from now, but yeah, you're right.
Let's hope not. Let's hope
But
not.
it will happen though.
Yes,
All
yes,
right.
yes. And it's multi-generational. And
Mhm.
I always say, I mean, look back through history. Who started the change? Mostly young people.
Mhm. Yeah. Yeah. It's young people that really carry the movement forward. They just hope that they carry it in the right direction and they don't get influenced by these outside voices to make up their opinion on something. Just like people are easily influenced to buy certain products that have protein on it just because they're seeing the label. And I think a lot of movements also have that. They just see the label and they believe, like, how can I oppose that? But under that label, there might be some bad actors.
Exactly.
So,
Yes. Yes.
all
Yes.
right. Well, it was a great conversation having you on here.
Yeah, and now you've fueled my, I've always been about food insecurity, and there's just so much to do. But when I get to Congress, I hope we can work on something like that together.
Hopefully. Well, thank you for coming on.
Thank you so much. All right, Erik, have a great day.
All right. You too.